Well, good morning, everybody. It's great to see a good turnout this morning for our public session, which is actually part of the Diet and Optimum Health Conference that was held here over the last 3 days, organized by the Linus Institute. My name is Balz Frey. I'm the director of the Institute, and I will co-chair this session with my colleague Emily Ho, who is also from the Linus Institute, and in addition, she's the endowed director of the Moore Family Center for Whole Grain Foods, Nutrition and Preventive Health. This public session on whole food approaches to disease prevention is sponsored by the Linus Institute, but also the Moore Family Center for Whole Grain Foods, Nutrition and Preventive Health. Before we proceed to the session, I would like to thank the many conference sponsors without whom the conference and today's session would not have been possible. And they include Bayer Consumer Care, DSM Nutritional Products, USANA Health Sciences, Pfizer Consumer Care, Pharmavite, Unilever, Hopsteiner, Juvenon, Roman Meal Company, and last but not least, the Stash Tea Company. In addition, we had support from Oregon State University's Research Office, and then also, most importantly, of course, from the Moore Family Center and the College of Public Health and Human Sciences here at OSU, as well as a grant from the National Center for Complementary and Alternative Medicine, which is one of the National Institutes of Health. Now it is my pleasure to hand the microphone over to Emily Ho for her welcome on behalf of the Moore Family Center for Whole Grain Foods, Nutrition and Preventive Health, and then to introduce our first speaker of the morning.
Thank you, Dr. Frey. As director of the Moore Family Center and member of the LPI, it's my pleasure to welcome you to this session on whole food approaches to disease prevention. The Moore Family Center is OSU's newest nutrition research center on campus and is dedicated to helping individuals and communities live healthier through healthy foods and good nutrition through education, research, and outreach. Whole foods and diet approaches are a major focus of the Moore Family Center, so I'm really excited to be able to share with you today's program that really focuses on food approaches to disease prevention. And we've invited some of our nation's leaders in the areas of food, nutrition, and health. There are a few minor changes to the program this morning, so if you haven't picked up a new program, there are some near the back, but we've changed the order of some of our speakers this morning due to some travel plans, but we have 4 speakers planned for this morning. Each will talk for about 25 minutes, and after each talk, we'll open up the floor for a question period for 5 to 10 minutes. So with no other comments, I'll introduce our first speaker. Our first speaker is Dr. Penny Kris-Etherton. She is a distinguished professor at the Department of Nutritional Sciences at Penn State University. And she's going to talk to us today about the effects of whole grains and nuts on cardiometabolic syndrome risk factors. Thank you and welcome.
Thank you very much, Balz and Emily, and I am delighted to be here today at this conference to talk about 2 foods that have remarkable health benefits. Let me just step back for just a minute and thank the organizers for the committee and the sponsors for the invitation to be here today. So I'm going to talk about all of the health benefits of whole grains and nuts on a number of risk factors for cardiovascular disease and cardiometabolic syndrome. So we'll just very briefly define cardiometabolic syndrome and then talk about what the current dietary recommendations are for whole grains and nuts, and then provide information on the evidence to support these dietary recommendations. Then we'll sum it up. So the WHO, recently released a report on the global burden of disease. And what you see here in 2010 is that ischemic heart disease is the leading health problem in the world, and stroke is number 3. So these are cardiovascular health problems. And you can see how that's changed from 1990, where lower respiratory disease was number 1, diarrhea, preterm birth, and then ischemic heart disease was number 4. So this is a very, very serious problem worldwide, not just in Western societies. And in this report, the top 12 risk factors were also listed. And so you can look at how these have changed from 1990 to 2010, but I think the ones that are relevant to what I'm going to be talking about today are high blood pressure, high body mass index, high fasting plasma glucose, and then even high salt intake, and low nut and seed consumption. And I think that that's very, very telling that one of the top 12 risk factors for the major health problems in the world are low nut and seed consumption. So I think this is a good launching point to talk about nuts and seeds, as well as some of these other risk factors that are contributing to this huge global burden of disease. And so when we look at cardiometabolic risk, I think it's really important to note that it's comprised of a number of different risk factors, as you can see here, and they're shown on this slide here, and they include established risk factors for heart disease like high cholesterol levels, and then a lot of other risk factors as well. And key to all of this is insulin-resistant syndrome, which relates to dyslipidemia, high blood pressure, and high glucose levels. But you can take a look at the clustering of risk factors that are all contributing to cardiometabolic risk. And this is, a very serious problem worldwide. And in the United States, about 30% or more of the population has cardiometabolic syndrome. And worldwide, in Western countries, the prevalence is quite similar. But what's pretty remarkable is that in older age groups in the United States, the prevalence is much higher. So that in the 50-year-old group, 60-year-old group, over 50% of the population has cardiometabolic syndrome. So we talked about the clustering of risk factors that define cardiometabolic syndrome, and you can see them listed on this slide here. But basically, it's high blood pressure, high triglycerides, a low HDL, central obesity as defined by increased waist circumference, and elevated glucose levels. And then WHO also includes microalbuminemia, or increased protein excretion in the urine. So let's look at what the dietary recommendations are for whole grains and nuts. And you can see that American Heart Association, in their 2020 goals, which are designed to decrease risk of heart disease by 20% by the year 2020, we see that a primary dietary goal is to consume 3 servings of whole grain, fiber-rich foods per day. And a secondary goal is to consume nuts, legumes, and seeds, greater than or equal to 4 servings a week. And this paper written by Mozaffarian and colleagues about the components of a cardioprotective diet lists foods that we should be getting more of. And you can see we have very specific goals for whole grains, 3+ servings of whole grains per day in place of refined grains, and nuts. We should be consuming 4 to 5 servings per week. And these dietary recommendations, along with others, like including fruits and vegetables, fish and shellfish, dairy products, and vegetable oils, can really have a very significant impact on cardiovascular disease and, in fact, cardiometabolic syndrome. And these recommendations are consistent with those that were released in 2010 by the Dietary Guidelines for Americans report. And you can see that what's recommended is consume at least half of all grains as whole grains, and choose a variety of protein foods, which include unsalted nuts and seeds. So we have consistent messages about consuming whole grains and nuts and seeds for overall health, and also to reduce risk of cardiovascular disease. Well, when we look at what comprises whole grain foods, there are a lot of them. And they're shown on this slide here. And I know you're familiar with some of these. In the United States, most of our whole grains come from whole wheat. But you can see that there are many other sources as well. I think a lot of people are surprised that popcorn is a whole grain as well. Now, we need to eat it with a lot less butter and salt as well, but nonetheless, it's a healthy whole grain. And then in terms of tree nuts and peanuts, you can see those that are listed here, and there are many. So I think that just these two lists tell people, the population, that there are a lot of choices here. Goodness, if you don't like one type of nut, well, there are a lot of others that people can enjoy as well and derive a lot of health benefits. So let's talk about the evidence base for the food and nutrition recommendations for heart health. And this is, again, very, very remarkable and quite amazing. So from that cardioprotective diet paper, what we see here is beneficial associations from population-based studies showing cardioprotective associations of fruits, vegetables, and whole grains. And if you look at the bottom of the slide here, we see benefits on total coronary heart disease, total stroke, total cardiovascular disease, and diabetes. And so there's very consistent evidence that consuming whole grains has protective associations on these particular conditions, multiple conditions. And then at the top of this slide, we see benefits associated with nut consumption on total coronary heart disease and coronary heart disease death. And this is a wonderful study that came from the Harvard group. And they looked at weight change every 4 years in 3 large population studies: Nurses' Health Study, and then Nurses' Health Study 2, and the Health Professionals Study. And this particular slide that comes from the paper published in New England Journal of Medicine shows a summary of these results. And what we see here is that refined grain intake, that's the first circle on the slide, is associated with weight gain over a 4-year period. And in contrast, nuts and whole grains are associated with no weight gain over a 4-year period, and maybe even a weight loss, certainly no weight gain. And I think this is just really a very, very strong evidence, albeit population-based evidence, but making a case and supporting current recommendations for whole grains and nuts. Okay, so let's look at the whole grain literature now and all of the evidence that supports current recommendations. Okay, here is a recent study showing beneficial associations with whole grain intake on type 2 diabetes and cardiovascular disease. And what I think is amazing here with this research is that there are a lot of studies and they're all consistent. And it clearly shows protective associations of whole grain intake on type 2 diabetes and cardiovascular disease. And these may be explained by lower glucose levels, lower cholesterol levels, LDL cholesterol levels, lower systolic and diastolic blood pressure, and no weight gain. In the Nurses' Health Study conducted in Harvard, 3 servings of whole grains per day decreased risk of stroke by 36%. That's really a remarkable benefit with just 3 servings of whole grains. And more evidence showing that whole grain intake is associated with a decreased body mass index. And I think this is really interesting because if you look at the amounts of whole grain intake, you can see that in the 5th quintile, they're not even consuming 1.5 servings a day. It's 1.4 servings a day. And you can see, benefits on both BMI and insulin by just small increases in whole grain intake. And then from the NHANES study, what we see is that, again, a whole grain serving of 1 or more a day is associated with a decreased body mass index and a decreased waist circumference. So again, small changes, small increases show, I think, significant benefits. And then whole grain intake is inversely associated with metabolic syndrome in older adults. And so if you look at the bottom of this slide here, what we see is that by going from the first quintile to the second quintile to the third quintile to the fourth quintile of whole grain intake, there are, remarkable benefits. There's a greater than a 50% reduction in decreased risk of metabolic syndrome by increasing whole grain intake. And what's amazing here too is if you look at numbers of servings a day in the fourth quintile, it's about 3 servings a day. So 3 servings a day of whole grains can decrease risk of metabolic syndrome by over 50%. Pretty amazing. And also, I think this is, just very, very, very striking as well, and that is associations with whole grain intake and total mortality. So for the Harvard Male Health Professional Studies, 1 or more servings a day of whole grains decreased overall mortality by 20%, and also in the Iowa Women's Health Study, about 14%. And that's, 3 servings. So you don't have to eat tons and tons and tons of whole grains to derive benefits. So how might whole grains be working? Well, in this study, there was decreased association with whole grain intake and hypertension. And so that being in the 5th quintile decreases risk of hypertension by about 19%. And then also consuming whole grains decreases total and LDL cholesterol levels, so that there was a recent Cochrane meta-analysis that came out, and then even more recently, a systematic review of whole grain literature, and 3 to 5 servings a day in the third bullet point below shows that total cholesterol decreases 32 milligrams per deciliter, LDL cholesterol about 28 milligrams per deciliter. These are huge decreases with just 3 to 5 servings of whole grains per day. And then in oats, one of the bioactives is beta-glucan, and systematic review basically showed that with 3 grams of beta-glucan per day, LDL cholesterols will decrease 5 to 10%. So that's in addition to the whole grains that people get mainly from wheat in the United States. And so I wanted to tell you about a little study that we did at Penn State. We conducted a controlled clinical study looking at the effects of whole grains and refined grains on resolution of metabolic syndrome. And we also looked at abdominal obesity, and we're still analyzing the abdominal obesity data right now. But we enrolled 50 participants in the study, and then half of them were on a whole grain diet, and the other half were on a refined grain diet. And we implemented like an isocaloric diet design, and then they lost weight, and then they maintained weight. And so in this study, the refined grain group got all refined grains. They got 6 servings a day. And the whole grain group got 6 servings a day of whole grains. The refined grain group got 6 servings a day of refined grains. And what was pretty amazing is even with weight loss, the prevalence of prediabetes did decrease a little bit in the refined grain group because of weight loss. But basically, we really cured prediabetes, so to speak, in subjects on the whole grain group who also lost some weight. So this is pretty amazing to be able to just cure prediabetes, because as we know, prediabetes is a harbinger of diabetes. And so that if we look at the benefits of whole grains versus refined grains, what we see here is that compared with whole wheat, refined wheat is stripped of a lot of vitamin E, vitamin B6, magnesium, manganese, fiber, zinc, potassium, copper, pantothenic acid, folate, protein. And then in terms of niacin, iron, thiamine, and riboflavin, it's added back with our fortification practices and enrichment practices. But despite that, despite the fact that we're replacing a lot of these B vitamins and iron, still we're not replacing a lot of other important nutrients that basically are wiped out with the refinement process. Okay, so let's turn our attention to nut and peanut consumption, and again, some incredible data. This is a summary of the epidemiologic studies that show dose-response relationship between nut consumption and reduced risk of cardiovascular disease, coronary heart disease. And what I find remarkable here is that the results are amazingly consistent. You see clearly a dose-response association such that consuming nuts and seeds 5 times a week or more decreases risk of cardiovascular disease by about 40%. And so again, this is really important data that supports that recommendation from American Heart to consume nuts and seeds greater than or equal to 4 times a week. This provides a little bit more detail about the epidemiologic data, and I just chose to include it because, again, we see very consistent data from a lot of different studies on many different cardiovascular disease endpoints. Fatal coronary heart disease, total coronary heart disease, and I'm not going to read all the rest, as well as all-cause mortality. So, like with whole grains, with nuts, they're benefiting all-cause mortality and a lot of other cardiovascular endpoints. What this slide shows is a dose-response relationship between nut consumption and decreases in LDL cholesterol, the LDL to HDL cholesterol ratio, and triglycerides as well, all important risk factors for heart disease and cardiometabolic syndrome. And this was, I think, a really nice systematic pooled analysis that Joan Sabate did with 25 feeding trials, including 1,284 data points. So real strong data here that's summarizing the nut literature. And it's, a recent analysis. Interestingly, the predicted response, the predicted LDL cholesterol lowering response, is less than what we actually observe in the clinical trials. So there's a greater LDL cholesterol lowering response than what would be predicted on the basis of the favorable fatty acid profile of nuts. And this could be because there are other bioactives in nuts that are causing a cholesterol lowering effect. So what else do nuts do? Well, this study that was done by individuals in Spain basically showed that walnuts basically open up the arteries, and they improve endothelial function in hypercholesterolemic individuals. So you can see the control group and then the walnut group. And in response to consuming walnuts, the arteries just become more relaxed and healthier. We just published a study looking at the acute effects of walnut consumption on reverse cholesterol transport. And as you know, this is one of the mechanisms that is cardioprotective, and that is HDL cholesterol participates in the removal of cholesterol from the arteries, and then the transport of it to the liver for excretion. And so that in this little postprandial study that we did, we basically showed that there was an increase in free cholesterol efflux. This was in cell culture, but it was in an ex vivo study. So we fed subjects walnuts, and then we took their blood, and then we incubated it with cells in culture, and basically showed that there was an increase in cholesterol efflux in cell culture, which likely would mimic what would happen, in the body when somebody consumed walnuts. So this is a real exciting finding, and it basically shows that walnuts, maybe other nuts, have their cardioprotective effects mainly because they participate in reverse cholesterol transport. They improve HDL functionality. So HDL is just more potent in taking cholesterol out of the arteries and dumping it in the liver for excretion. What we know is that nuts affect a lot of risk factors for heart disease, oxidative stress, and you can see the antioxidants that are listed in a lot of different nuts. They have anti-inflammatory effects. Many studies have shown this, and a number of studies have shown improved endothelial function, and we can add cholesterol efflux on this list as well as another way in which nuts exert cardiovascular benefits. And there are lots of bioactive compounds in tree nuts, and I think that right now this is pretty much the tip of the iceberg because we need to delve down and identify particular phytochemicals, flavonoids, phytosterols, proanthocyanidins, and all the different antioxidants that are having very specific effects and what those effects are. And this slide shows that nuts in general have a lot of are high in antioxidants, and there are differences among the nuts. As you can see, pecans have the greatest antioxidant capacity, but nonetheless, there are others too that are high in antioxidants, and in fact, all of them have some antioxidant capacity, and that could be another way in which they work. This is an interesting study because it basically shows that people who eat nuts overall have a better nutrient profile of their diet. So you can see that, compared with people, so it would be on the right-hand side of the slide, people who don't eat a lot of nuts, people in the middle panel there who eat some nuts just have a healthier diet quality index. They consume fewer solid fats. They consume fewer added sugars and fewer solid fats, added sugars in general, total. So, consuming nuts may help people eat more healthy. So let me say just a few words about what I think is, again, just an amazing study, the PREDIMED study, which came out, just a couple of months ago. And this was in the New England Journal of Medicine, Primary Prevention of Cardiovascular Disease with a Mediterranean Diet. Here's the PREDIMED trial design. There were men and women at high risk of cardiovascular disease between the ages of 55 and 80. And you can see that these were smokers, people who had high blood pressure, high cholesterol levels, overweight, obese, and a family history. And a lot of these people were taking drugs to control these risk factors for heart disease. They were randomized to one of three diets: a Mediterranean diet with olive oil, Mediterranean diet with nuts, or a control group, which is a lower fat diet. We'll look at this in just a minute. And this is a large study. There were 7,500 individuals that were randomly assigned to these three treatment groups. And so that in the Mediterranean diet group, there were those who consumed extra virgin olive oil plus a Mediterranean diet, or a Mediterranean diet plus nuts, 30 grams a day. And in the olive oil group, they consumed 1 liter of olive oil per week. And that's pretty typical, pretty normal for people in Spain. But you can see the foods that they were eating on the right-hand side in the lower fat control group. What I think is interesting is, they were consuming a lot of refined carbs: bread, potatoes, pasta, and rice. And so these are the differences between the two Mediterranean diets studied. So the Mediterranean diet with extra virgin olive oil actually gave subjects 1 liter per week of extra virgin olive oil. And with the nut group, they consumed 30 grams a day, of which they consumed 15 grams of walnuts, 7.5 grams of almonds, and 7.5 grams of hazelnuts. And these are real popular nuts in Spain. And so I'm just including this slide only to show you the difference in the fat content. The Mediterranean diets provided 41 to 42% calories from fat. These are real high fat diets. And the control group was not a low-fat diet by any means. And, you know, the average American consumes about 33% calories from fat. So this was higher than what the average American consumes. And all of these diets were low in saturated fat. And here are the amazing results. Just think about this. These are people at high risk for heart disease. They're on meds to deal with these risk factors. And diet alone, the Mediterranean diet with nuts, the Mediterranean diet with extra virgin olive oil, decreased the incidence of acute myocardial infarct, stroke, and death from cardiovascular disease. Truly amazing, by about 40% or so. And there were no effects on mortality. Interesting as well, there were significant effects on stroke, in particular, of the two Mediterranean-style diets. You can see right on the bottom there, or I'm sorry, you know, the box on the top and the two bottom lines there. So stroke was markedly reduced in people on the Mediterranean-style diet. So the word is getting out about the health benefits of nuts, and you can see what's happening to world tree nut production and peanut production over the years. It's growing. So what's good news here is that we are eating more nuts. It's great. I think that'll be really helpful. So in summary, whole grains and nuts decrease multiple cardiometabolic syndrome risk factors via many different mechanisms. They favorably affect lipids, lipoproteins, blood pressure, glucose, body weight. But, you know, as good as these are and as much evidence as we have, we really need to help people, encourage people to eat more whole grains and nuts. So I think our bottom line message is consume fiber-rich whole grains, enjoy nuts for health, and with that, thank you very much for your attention.
Thank you for such an enlightening talk. We'll open up the floor for questions. We have two microphones, one in the center of the room and one on your right, so if you'd like to ask a question.
Hello. Thank you very much for your wonderful lecture. I had a question about the study comparing the refined diet, refined grain versus the whole grain in a prevention trial that you briefly mentioned. And so how long did you have to do the follow-up study to actually see that difference?
Yeah, that's...
And the second question is regards to the reverse cholesterol transport experiment. Was the capacity for the reverse cholesterol transport related to the HDL concentration, or was there any patterns in terms of HDL particle size that you observed?
Yeah, good questions. Okay, so in terms of the study that we did at Penn State, we had about a six-week isocaloric diet, and then about a 6-week weight loss diet, and then about a 6-week weight maintenance diet. And so at the end of all that, like 18 weeks or so, we saw remarkable decreases in blood glucose, especially in the whole grain group. There was a teeny bit of a decrease in the refined grain group.
And it was driven mostly by glucose and not drop in insulin?
It was mainly glucose.
Okay,
yeah.
thank you.
And then in terms of our reverse cholesterol transport, we did two things. And this was all done by George Rothblatt at UPenn. So he's an expert on looking at reverse cholesterol transport. And so this was just a little postprandial study that we did. And we looked at walnut components. And so the whole walnuts had an effect, and walnut oil actually had an effect too. So, with one of the analyses, he did ApoB depleted lipoproteins. And so that analysis just approached significance at the 0.07 level. And it probably was because there was a lot of variability and small sample size. We only had 19 subjects. And so, with the data I showed you, it's whole plasma. So it's not just HDL. And there are some studies that show that maybe there are some other lipoproteins that play some role in cholesterol efflux. We haven't really looked at all the different particle sizes in that study.
Thank you. We read a lot and we heard a lot about the Mediterranean diet. I was wondering if most of the studies that do apply Mediterranean diet factor in the fact that a lot of Mediterranean people don't drive everywhere they go, don't have probably as many cars, they use public transportation, and that's a daily exercise. Do any of these Mediterranean diet studies include that in?
Yeah, that's a good point, and maybe Eric can address this as well. But in this clinical study, one would go so far as to say all the treatment groups then continued with the same exercise pattern, and so that I think what we're really seeing in the Predimed study is a diet effect that's related to extra virgin olive oil and nuts.
But can we apply these to the American diet in a way to improve the exercise and improve their dietary intake?
That's a good question. We need to do a Predimed study in the United States.
Thank you.
Uh-huh.
I'm interested in the context in which you eat some of these component foods. It would be a lot more fun to eat a big piece of pecan pie with a whole wheat crust than it would be to have a piece of dry toast and a handful of nuts.
Yeah.
Can you comment on that?
Yeah, that's a good question. And I think as soon as we start telling people, eat more nuts, eat more whole grain, they find all these unique ways that are pretty inconsistent with some of our current messages to eat them. And so, if you think about American Heart recommendations, if you think about dietary guidelines recommendations, we don't want a lot of added sugars because and a lot of solid fats, because they don't have health benefits and they're not nutrient-dense foods. And so, still I think we want to try to eat whole grains and nuts in a more healthy way and not think of ways that, I think people may find even more delectable.
Go back to the middle.
Simple question. How does cooking affect all these phytonutrients and all the values if you bake the bread and boil your oatmeal and so on?
Well, that's a good point. And so certainly with some phytonutrients, they're destroyed by cooking, but others aren't. And that's where I think, we're looking at the tip of the iceberg. What are the particular bioactives and how does each one work? And how can we get the most of each one? And maybe it's not cooking them, processing them in any way.
I'm a commuter and I eat nuts when I drive back and forth to work.
Great.
And when I'm sleepy at night, I eat nuts to stay awake in front of the television. Do I have to be concerned about eating too many nuts?
Well, that's the question. Of course, you can't exceed your calorie limits. And so my concern is that as soon as we tell people that a food is good, they put it on top of their existing diet and they're eating excess calories. So that really is, I think, a challenging message that we have to deal with. And tell people how to incorporate nuts and whole grains in their diets to meet their calorie needs. And so the message then should be replacement. And so I would think that you're obviously replacing your nut calories with something else. And like with whole grains too, replace whole grains with refined grains.
Thank you.
Penny, just to quickly follow up on that question, how important is it to consume unsalted nuts versus salted nuts?
And unsalted too. Both the Dietary Guidelines for Americans and American Heart recommend unsalted nuts.
I'm from Mediterranean, and we consume a lot of olive oil. Is the most secret component in our food. The olive oil contains just one double bond between 8 and 9, and the others contains more than double bonds. It is not easy to oxidize it or to produce free radicals like the others. That's why the others produce high free radicals and cause a lot of problems. This is the point. The same time, olive oil, it contains chlorophyll and other things, which is good fighters for good health.
Yeah, very good point.
Thank you so much for your informative talk. To elaborate on the preparation question, are you planning on taking a look at all on the different preparation and the micronutrient bioavailability from, say, fermenting or sprouting whole grains, and also about the anti-nutrient content of whole grains and nuts? Have you guys looked at that at all?
Well, I know food scientists are looking at that, and so maybe somebody can clarify that, because I'm really not up on all that detailed literature. But it's a very good point.
Okay, I know myself, I've found that I'm sensitive to anti-nutrients, and so are a lot of people who have a predisposition to autoimmunity via a process called molecular mimicry, which is very fascinating to look at. But it's actually these anti-nutrients found in whole grains that are causing this inflammatory response. I'm also wondering about the omega-6-3 ratio and what you think might be an ideal omega-6-3 ratio, and if you've taken a look at what the ratio is in these recommendations for whole grains and nuts.
Yeah, the N6-N3 ratio is something that's quite hotly debated among scientists. And I think the bottom line here is that, I always fall back on what WHO has recommended in a large fatty acid report. And they say the N6 to N3 ratio really doesn't matter so much if you have adequate amounts of omega-6, if you have adequate amounts of omega-3 fatty acids, and adequate amounts of both the shorter chain and longer chain omega-3 fatty acids. So, the ratio is important to those who think it's important because of competitive inhibition for some of the enzymes that convert the shorter chain omega-3s to the longer chain. But if you're getting those longer chain omega-3s, adequate amounts, eat 2 servings of fish per week, seafood per week, preferably fatty fish, it really doesn't matter.
Thank you for your insights.
Excellent presentation. My one concern was on that topic itself. I'm of Greek heritage myself, and I consume about a liter of extra virgin olive oil, Evo, every week myself.
Wow, that's great.
And the one slide that disturbed me was that you were showing an increase in vegetable oils. And vegetable oils are primarily omega-6 fats and highly processed. So the phytonutrients and the health benefits you're getting from olive oil are not there in the omega-6 fats. So that disturbed me a little bit.
Yeah, I think that's a very, very good point, and that's why I kept saying extra virgin olive oil compared to refined olive oil, to speak to your point. And I know in the next talk, Eric is going to talk all about that. So he'll answer your question.
Actually, it's incorrect that salted nuts are high in sodium. 1 ounce of almonds is 4% daily value, which is less than 120 milligrams. An ounce of Cheerios is 12% daily value. So if people are going to eat nuts and they're not going to eat them raw, they're not doing something terrible if they're eating them salted.
Yeah.
So.
Okay, thank you. Good point.
Yeah, we'll do one quick question left. Sorry.
Okay, thank you. I want to know, I heard a study recently, I want to say it was out of Sweden or Norway, one of the European countries, regarding fish oil. I don't know if you're familiar with it at all, but it basically in the study they found that, because I've always been a big fish oil proponent, that it didn't have any effect at all on reducing, I believe, stroke and cardiovascular issues, and there may have even been some possible negative things from, I want to know, I didn't get to hear all of the information on it.
So this is another very interesting topic, and so I'll make it real quick, but some of the newer studies are not showing benefits of fish oil and fish consumption and omega-3s on cardiovascular endpoints. And when you look at all those studies, there are some problems with them. One is, they don't give high enough doses like some of the early studies did, like the JISI study, and they don't have a long enough follow-up period. And I think beyond that, And a lot of them haven't used long-chain omega-3s. And then just finally, since GISI was done, our standard of care for people with heart disease has changed dramatically. And so that way back when GISI was done, people would have a heart attack and we would intervene, but now we're intervening so aggressively that, maybe that's the reason why some of the new studies aren't showing benefits in patients who have a heart attack. And so the other thing is, some of these newer studies, they start people on omega-3s a long time after a heart attack. And so maybe it's that delay as well in starting with the intervention that's causing an effect, but not causing an effect. But, I think the message here is continue to eat fatty fish, and emphasize low mercury fish. There are some data showing that, high fish consumption where fish is high in methylmercury might be counteracting some of the benefits of the omega-3s. So I think the very best advice right now is don't throw the bathwater out with the baby with the bathwater, and continue to eat fish and follow those current recommendations that are very recent, but choose fatty fish, and salmon in particular is one that's real high in omega-3s and low in methylmercury.
And the fish much better than taking the fish oil supplements, you would think, the actual fish themselves?
If you can't, well, as a dietitian, I say food first. And fish brings with it so many other things beyond just the omega-3 fatty acids. But, if you can't get, enough omega-3 fatty acids by eating fatty fish, some people can't, supplements are okay.
Thank you.
Well, join me in thanking Dr. Kris-Etherton for a fascinating talk and discussion.